insurance has evolved to push more of the cost to the patient directly, this has made us move it out to the front of the house. Therefore, oncology specifically is one that has to have that conversation with the patient prior to starting treatment. We want to let them know what their out-of-pocket costs are as compared to the care plan that they're receiving, so that they go into it wide open, eyes wide open, and understand what it is going to cost them. And traditionally, hospitals have done that on the back end after the services have been incurred. So as we evolve in the healthcare industry, we recognize that we're moving things from the back end to the front end. With the ACA in place, we now have more patients that have coverage that need help with the explanation of their benefits and helping them understand what those costs are and when they will hit those costs in their care plan. Versus the old way, when patients didn't have insurance, they either went to the main hospital to fill out the application there, or we went down the road of charity care. But either way, we have to determine the patient's financial situation and help them figure out how they're going to pay for their services, even if that means deviating from the payment plan set forth by the hospital and creating one that is tailored to their financial situation. First thing that you want to do is take inventory of what you already have. As we've talked about, things that are centralized, you don't want to reinvent the wheel. That's not the intent when you look at decentralizing your model. If you have a department within your hospital that helps patients that are uninsured apply for state assistance, that should stay where it is. But what needs to come into oncology specifically is those patients that need extra help. Those patients that need grant funding, that have a very expensive treatment and don't know how to pay for it. So the metrics to determine whether you have a successful program or not is first determining your need. When you look at your patient population, how much of your accounts receivable is still sitting on your patients? What is your percent of collection on that? After insurance is paid, after copays are collected, what are your outstanding balances? And how are you going to get that? As this evolves, financial counselors can anticipate what those are going to be, and they can help the patient understand that as well. And when you do that, you help them set up a payment plan so that everything works. And those are the metrics that make this program successful. You also have to determine what's out there and what do you have. You have to take inventory of your program. What is it that you're trying to do? If you want to improve your collections, that's going to be one of your metrics. If you want to help patients with copays, that's one of your metrics. Whatever it is that you're trying to accomplish, all of those things that are very tangible, and I stress that, things that you can measure, those are the things that have to be measured, and they have to be measured regularly.